5:23 now in Daybreak. Breakthroughs, cancer treatment, nothing new for Roswell Park. But in this case, the breakthrough is an entire department, a first of its kind.
In this morning's America 250 report, we look into the Roswell Park Department of Indigenous Cancer Health. Within this world-class cancer center is something equally special. Roswell Park's Department of Indigenous Cancer Health. It's the first of its kind in the country, tackling a variety of hurdles that stand in the way of treatment on native lands.
Sometimes there's challenges in getting to appointments or feeling comfortable going to an appointment that may be off territory in a larger institutional setting.
Cancer rates on Indigenous lands are disproportionately higher for a variety of reasons. Rodney Herring is the department chair.
So our people have experienced trauma, historical trauma in that way, which, downstream in thinking about the way we interact with healthcare facilities and institutions of care and education and learning, all plays into that way we understand health, medicine, and the care that we receive from others.
Roswell Park sits on traditional Seneca land, and this department says its work reflects Haudenosaunee principles of strength, peace, and good mind. A big part of their mission is to connect Indigenous nations when it comes to healthcare and cancer treatment.
By building healthy partnerships and understandings and ways from anything from research to services in our community, patient navigation to education programs for our youth, to become the next Indigenous cancer scientist or physician are really important in the steps we take to move forward in good ways.
The department also honors the value of Indigenous knowledge, sovereignty, and respect for the environment through community-driven partnerships.
Sovereignty is always local. So that means that each nation has their own way that they would like to practice who they are. And it's so important for us as practicing our collective identities and finding our own uniqueness within that larger picture.
And that is in both urban and rural settings. Their focus is on education and collaborative research, including cancer prevention and behavioral intervention, cancer screenings, clinical trials, and engaging students in Indigenous cancer research, building bridges and building trust.
What is the current trust between tribal nations, the health systems, and a large, cancer institute? What does that look like, and how do we find the best ways to move forward in partnership to make sure that the goal really is, how do we save more lives?
Working with partners across North America, they aim to coordinate educational events, host health screenings, conduct research, and develop action plans to address not only cancer health disparities, but larger issues that impact wellness, such as human relationships with the environment.
It's a pretty big responsibility covering all of Turtle Island and connecting with a lot of Indigenous tribes, and it's a huge honor putting our work into Indigenous sovereign communities and them putting their trust in us to provide education on lung wellness and bringing that education, hopefully that knowledge brings them, to lung cancer screening.